We will now proceed with our panel discussion, and I will ask Lisa, David, and Shruti to join us again for the panel discussion, and to welcome Dorothée Rouzet, Chief Economist at the French Treasury, where she oversees the economic and forecasting analysis determining France's fiscal and macroeconomic policy. She has pursued a career path combining the academic, applied policy, and private sectors, and has previously served as a senior economist at the OECD. Now, we have enough material to start our discussion, but just a few thoughts at the beginning. To summarize a bit what we discussed in these morning sessions. As life expectancy steadily rises and population ages, our institutions built to operate accommodating a shorter lifespan face a crucial challenge. And by being a political scientist, here the slogan is institutions matter. And as David stressed it, we have to think about institutions and policies. So this discussion is going to be dedicated to suggestions for policy implications and institutional redesign. Among others, the longevity society is not only about people living longer. Among others, it refers to reshaping how we live, learn, work, and contribute to the society's welfare across an extended lifespan. To rise to this challenge, governments, firms, communities, in general must reimagine the architecture of systems that were not designed to serve a longer lifespan. One can think of several institutions in our societies whose operation and effectiveness are drastically affected by the longer lifespans. The organization of work, educational and training schemes, pension systems, healthcare, long-term care, and preventive care systems are examples of such frameworks that should undergo structural adjustments to live up to the reality that the longevity society establishes. Effective policies governing the operation of such institutional frameworks should be put in place to address the emerging challenges. What we need is rethinking the role of states, the role of firms to support not just longer lives, but also better ones. The reforms affect all stages of the multi-stage life, and they affect in the earlier, middle stage, the career, but also elders who should be viewed as invaluable human capital with wisdom, time, and experience to put forward. To name a few challenges, one could touch on the workplace improvement, enablers for facilitating working in teams, or more apt to the concise job descriptions that contribute to a better matching of people's skills with job requirements. Another example could be offering older people who are about to enter a pension scheme the opportunity to continue working in their current role, rather than having firms to recruit them again from scratch or being recruited in a role that does not match their skills. But I stop here. To deep dive into these concerns, allow me to turn to our distinguished panelists. We heard them today with the first round of their speeches, who will shed more light on these issues. We are going to have 2 rounds of questions. I will start with Lisa. Lisa, you have conducted much research for understanding the relationship between work policy and health. And just to elaborate a little bit more, based on your work, or your current work, how can firms achieve employee health improvement while boosting corporate output, which is a more specific question. So.
I think of all the social determinants of health, I always think that work is the most modifiable. I want to say corporations change work practices all the time. They mostly do it for reasons of profitability or better business decisions, but they understand organizational change. It isn't a foreign concept. It isn't one where people ask individuals to change their behavior. They understand organizational change. So to me, it is like one of the most important areas that we could focus on, and involves both private and public kinds of policy changes. It's a place where you can ask private companies to change, as well as policies. And I think having flexibility in some ways, not focusing all on early childhood, on parental leave, although I do think part of that fertility issue is completely about people who decide that they can't have children because they have to work. Japan is probably, the most clearest example where people feel they have to make a choice. But nonetheless, I think modifying how we work is one of the best avenues, and there are many, many examples of ways that we might go in to do that both involve public policy as well as private policies.
Okay, thank you. Now I turn to David. David was stressing a lot about the institutional reconstruction, let's say, to how we are going to redesign our institutions based on the findings of your work, which, according to your opinion, are the main policy challenges that will enable us to reap the expected dividend of healthy aging in terms of growth.
Yeah, so I think I was very forceful on the fact that we need to change. What we need to change to is a much harder question. And I think there, the enormous challenge, I think, is on the heterogeneity. We talked about it. I didn't have time to talk about this issue that there's enormous inequality in income, but also in health. And the inequality is worse than we think because of the incredibly high correlation between health and income. So the people who are well off are living a long time. The people who are low income are living a short time in poor health. And I think that we need to design institutions that take account of that heterogeneity. So for example, at the moment, the pension system is much more beneficial to the high income people who have long lifespans and benefit from the design of the system. But I think if you're going to make it heterogeneous, it's not just a function of age, you have to make it a function of people's characteristics. And that induces a lot of issues. So I think the standard idea in economics is you want to make it a function of invariant characteristics. Once you make it a function of things people can vary, you induce incentives. But I think it's a hard problem, but I think it's one that we have to address. And essentially, it means that the policy is more complex. And it's not just retirement at a particular age. It may be a function of people's health and productivity, maybe a function of their education level, maybe a function of their asset holdings. But all of these things are possible distortions, and so we have to think hard about optimizing in a world where there is heterogeneity and distortions. I do think that we are not locked into these systems that are very simple, but the systems that may be optimal may be more complex.
Okay, thank you very much. Now, I turn to Dorothée. Dorothée, in your diverse professional career path, you have focused, among others, on issues related to achieving inclusive growth in aging societies. So my first question, which I have prepared to help the discussion here, and of course we can intervene and change views. What are the main challenges that policymakers face in their effort to lift employment and productivity in aging society?
Yeah, thanks. I mean, perhaps the first thing is when you say lifting employment productivity, I think, we've had this discussion yesterday. The impact of aging on employment is fairly clear, on productivity, not so much. Probably on productivity, I mean, we have a general productivity slowdown. The part that aging is playing in that is not so simple. So there, I mean, the recipes are more general. I think we know where our challenges are in terms of productivity, in education, in fostering innovation, fostering entrepreneurship. I think where we are a bit short still in terms even of analysis and recipes is in thinking how do we adapt our recipes in terms of boosting productivity to a world in which the average worker is older, or to a world in which the average career is longer. So we think we need to improve our education system, but we also need to think about, what are the hard and soft skills that our kids will need when they might, change occupation 3 times in their lives, and we need to prepare them for that, and probably that's more of a focus on sort of soft skills and adaptability than we are doing now. The same for innovation. In some ways, a lot of this is not specific to aging. I think one question that was also touched on yesterday is what does entrepreneurship look like, and business dynamism in aging societies? I think there's this assumption that the entrepreneur is sort of this young startup-er, but older people have more resources and networks and experience, so they might be successful entrepreneurs, but may not have the information support for that. So I think it's more about rethinking our sort of cross-cutting policies in light of aging. On lifting employment, I think we've heard a lot. In some ways, we know what we have to do. The hard thing is actually doing it. I think there is a tension when we focus on extending working lives, and David has said, on between doing something that is simple and understandable. Pension systems are complex. People don't know what their rights will be. So saying, you can retire, we've had this issue in France many times, saying, you could, minimum retirement age was 62, we lift it to 64. It's very easy. People understand it very well. They hate it. And they hate it sometimes for good reasons, because it's perceived as unfair. Not everyone is the same as 64. So it's perceived as putting a higher burden on people who started work early, who may not have had the most personally enriching careers. But on the other hand, if you make things complex, then it becomes really hard to understand. And there is the assumption that everyone will lose out. We tried a systemic pension reform, unifying all regimes, making it more flexible. It was so complicated. We tried it in 2019. Everyone was against it. There were winners and losers, but everyone thought they would be losers. So there's also this tension. I think once you start saying we need a lot of criteria, it becomes difficult. Part of the challenge there is also, and it's been said before, we don't really have a positive narrative around it in the policy circles. It is all about the disutility of work. We don't have a positive narrative about working longer, healthier, and I think this is something we've focused on. It's a good reason to focus on the 50 to 65 span, because that's where probably we have more scope to intervene. But I'm also struck by the fact that there seem to be some differences, at least when we like to compare ourselves to Germany and France. If I look at surveys in Germany about when people want to retire, the average sort of desired age of retirement is 1 year older than the average effective year of retirement. So people, in a way, would like to, on average, of course, there's a lot of heterogeneity, would like to work longer than they actually do. In France, it's the other way around, not surprisingly. But I think there is something to do about that. Very, very quickly on the other aspects, I think, we've also talked a lot. Shruti has said a lot about that. About one of the main challenges is training people for longer careers, rethinking lifelong training, both to slow down skill obsolescence for people who stay in their jobs, and to enable people to move between occupation if they so wish. It's really hard to do. In terms of take-up, for instance, if we look at lifelong training, especially for older people who are unemployed, that's where you get the most bang for the buck in terms of chances, in terms of the change in employment probability that you get from the training. That's also where you have the lowest take-up training. So clearly there's something we're not doing right there. And it's the reasons that are most often cited are either because the offer is inadequate, because the training for occupational mobility tends to be more than 6 months long, working towards a certification, sort of academic, and what you really need something short, focused on experience, immediately applied. So there's work there. But also, the reasons that are most often cited are lack of support for outright rejection by the employer. So that's also where we probably need more awareness. And that's, among, I guess, the challenges, that's the last one I will cite from the governance perspectives, is a lot of the things we discuss are not really, it's not easy to see what is a public policy lever, and I'd be curious to hear more. In some ways, I mean, a lot of things are just for the employers and social partners to think about. I mean, when we think age discrimination, adapting workplaces, age-friendly working conditions, thinking about career paths for people who are in long-term employees of a firm, sort of thinking of where they will go if the firm retains them until retirement age. And governments probably have a role to play here, but frankly, they're not the main actors, and these things change slowly. So I think from the policymakers' perspective, it's also a challenge that in a way you're held accountable for saying, well, if you want to increase working lives, then things need to happen that are slow moving and are more in the realm of the firm. But let me stop there.
Okay, thank you very much, Dorothée. Now I'm turning to Shruti. You have researched a lot on the labor market adjustments needed to respond to the demographic changes. So my first question is on how do you think that firms can best prepare to attain the benefits of the longevity society? An easy question.
Yeah, I think like Dorothée just mentioned, and Lisa said the same, that workplace settings, and I think the role of employers and corporate policies is really key here. And it's, in so many ways, very obvious. It's, like, as I said earlier, it's a place where we spend most of our time. It's an important determinant in terms of our decision-making, how long we stay in the workforce. It's also an important determinant of how well we will do and what quality of lives we will have after retirement. And so I think that's one area that I is still sort of underlooked into, actually, the kind of jobs that we have. What does that mean in terms of how well we age once we have really fully retired? I must say, I'm really excited. I'm going to show off a little bit here. I mean, I think for many years, the OECD has typically been focusing on public policy. In the last 4 or 5 years, we've really started to dig deeper into the role of firms and corporation. And we've been talking to a lot of large companies and small companies on understanding the barriers that they face. But as I mentioned earlier, they are doing some really exciting work, and which I think there's something to be learned for public policy in itself. And I gave the example of the UK earlier, where actually the financial sector had totally understood that their workforce was aging very rapidly, and they need to start thinking and helping them to actually retire and plan their retirement and skills and needs and so on. And this is an example of great partnership where the UK government actually thought, this is a fantastic initiative. We're going to actually pilot this at the national level. And so they've actually taken this initiative that's born in the private sector, piloted it, and it's something innovative. And we're waiting for the results to see what that's going to look like. But that's just one area. But the second is about educating the firm level, firm actors. And so here, I think sort of the terminology age management was first used by the European Commission about 40, 50 years ago. And we go around countries, and even within the public sector, people don't know what age management means. What does it mean, like age management policies? And so there's a huge lack of know-how what to do in terms of improving working conditions, making sure that employers give the right sort of working time arrangements. And oftentimes, as Dorothée mentioned, actually the issue is not so much that the policies aren't changing, regulations are changing, that they're responding. It's actually the take-up. Society, there's still a stigma at an older age or in your 50s to perhaps reduce your working hours or to work part-time, or as a woman coming back from maternity leave to do something else. And so that stigma is a huge issue. And I think this is where we need business leaders and leaders to actually step up. And we do see it in some of the large corporations, where actually to improve the take-up of some of these initiatives, that we need to sort of have sort of agents of change in this front. So I would say that I think firms are becoming extremely important. They are taking action. These are clever agencies. They're grappling with labor shortages, and some of them are actually responding and taking the issue at hand and recognizing the business case. Not, of course, not everybody understands the business case, but some large corporations do. And I think just to finish off my thoughts, it's also an important player, I think, in terms of advancing in research. When we talk about the issue of productivity and aging, in fact, the gold standard ideally would be, as economists, that we get hands-on and access to data, firm-level data, business-level data, which we can really use to see what's the relationship between working conditions or aging of the workforce with productivity. In fact, the only study that I've ever seen successfully done is the case of BMW car plant about 20 years ago. And it's fantastic that BMW actually offered this data set to see and conduct some sort of a trial to look at the productivity relationship. And so I think it's an important player in all aspects in terms of improving the evidence base for some of the very important questions that we're all grappling with, but also in terms of, creating change and leading in change as well.
Okay, thank you. Thank you very much. Now we start the second round, and we can receive also questions from the audience. The idea here is to extract as much as policy recommendations we can from your experience, and focusing on the policy implications on how we redesign institutions and public policies. So again, to Liz, I have a second question, more on what is the need to redesign the organization of the work and the career paths, based again on the work that you've done on this, or you're doing on this area, in order to support the healthier aging.
Yeah. I think the implication of the career path is that it doesn't have to look like what it looks like now. Like, we don't have to pack all the heavy years of work into the years where we're raising a family and have complications in so many ways. We could spread that out. Wouldn't it be nice to take a year of retirement in the middle of one of those working years, and in exchange for working longer for another year? The idea is that that kind of flexibility is open to us, really. It's our choice. One of the things I really did want to add is just, it's peripheral, but like about prevention. And this is that we've talked a lot about prevention. People in public health always struggle with like making the case for prevention, because basically if you're really good at prevention, nothing happens. And it's a population dynamic. You individually don't know whether you didn't get the disease. You only know on a population level that things have happened. So this whole idea of prevention, which is so fundamental to healthy aging, is something that needs to be framed in a way that you understand it better. And it actually is so much easier it's so much easier to say that you have a disease and here's a pill than to say we're going to prevent COVID with vaccinations. We're going to prevent polio, measles with vaccinations, or work is going to be a preventive in the long run and will promote healthy aging for it. So I think the idea of prevention is very important, and we get used to it, but it is a very hard sell in terms of people individually feeling like they reap the benefits for this.
Thank you. David, based again on your research, you mentioned it early on, we need to redefine some contents and to shed more light on the welfare as a concept, and concepts such as life expectancy and the relation between the dependent rate and all these kind of things, they have to be redefined. Can you enlighten a little bit more on to give you, more chance to give us what is the alternative, to give a new content to this?
I think we need a better welfare measure. I think a problem, I've worked with philosophers on this. And what I've learned is if you want a perfect welfare measure, you're never going to get it. There's a huge philosophical debate about what human welfare is. And so what I would really push for is a better measure, but not to try for perfection. I think we need to measure income, we need to measure health, we need to measure leisure. I think there are other aspects of life. People really value respect. Actually, people value having children. But getting valuations for everything and including it in a single measure is really hard. I think we can do much better with another measure, which again will be approximate, but better than income per capita. So trying to have perfection here is a recipe for disaster. I would also say one thing I think is really lacking in the economics approach is human rights. People are very concerned about human rights. We don't have a good way of putting human rights into our welfare approach. And I actually think that a better place to talk about human rights in economics would be in the constraints. Is that we think of constraints as being resource constraints, but we might have things in our welfare approach which say there are some human rights constraints on what we do and make them really fundamental. But I think these issues around broader notion of welfare and human rights are really central, and until economics really incorporates them, we're sort of missing the point, I think, in the public policy discussion to some extent. I would like to say something else about implementation. And I think that one of the issues is people are quite short-term in their outlook, and we need to design policies that have a more long-term perspective. I think another really fundamental problem is that governments are short-term in their outlook. Governments, because of political pressures and elections, want gains now, not in the future. When you look at countries like Singapore, which are less electoral pressure, because they manage their democracy, they manage always to win, they have a very different approach. And so if you look at their pension system, it's fully funded. People contribute 30% of their salaries. That goes into a pot. They guarantee at least 4% return a year on that, on those savings. But it's fully funded, so there's no real sustainability problem and no intergenerational transfers. I think they have too little redistribution. They have some cohort redistribution to people who were alive prior to independence. They think those people are very poor. But it's not age-related, it's that cohort. They think that the rich people today who have earned a lot from the economic growth can take care of themselves. So I think there is this issue about moving to a longer-term perspective, and I worry a bit that democracies, because of the pressures of getting elected, aren't really well placed to do this. And I think when I talk about institutions, I don't just mean governments. I think families are very important, the private sector is very important, NGOs are very important, and we want governments may not be the right answer to this question. Because I think they're not well placed to address these sort of long-run issues, like the long-run process of population aging.
Unfortunately, democracy is, this is it's a problem that it's indigenous with democracy, because the electoral cycle is always shorter than a serious public policy reform, which takes over generation to reap the results of such a change, and then you have a problem of consistency and not. But now we move on to Dorothée with the second round question, and based again on your current work and experience, how you should prioritize reforms combining effectiveness and the financial sustainability in pension or healthcare and long care systems.
Yeah, I mean, if I had the perfect recipe for that, my life would be a lot easier. But I think, I mean, in some ways, we have to be quite practical about the reforms that improve fiscal sustainability and at the same time response to people's needs and preferences and concerns for fairness. I mean, we have that very acutely on pension reforms, because that's always where it's the most explosive. And I think there, the experiences, I mean, I mean, people do not like the idea of working longer, but I think there's a general understanding that collectively that's needed when we live longer, healthier. The details matter a lot. So, I mean, in France, we have a dual system in a way with a minimum retirement age and career length. Which lever you pull is very different in terms of social acceptability. The age is exclusive, career length is okay. And actually what, I mean, in the numbers that Angela showed earlier, pension expenditure is not projected to rise in France, and the reason for that is actually reforms from the 1990s that changed from indexation to wages to indexation in prices. There were no protests about that. No one, I wouldn't say no one noticed, but it didn't really raise problems in terms of political and social acceptability. And in the end, I think long-term that might be an issue because what it implies is that the fiscal sustainability relies on pensioners losing in terms of living standards compared to the rest of the population. But it's also part of the fiscal sustainability. I think where we have this problem now is when you start extending the rule for everyone, it is important to take into account the heterogeneity of situations at age 62, 64, 65. And there too, I think we have to be practical. I mean, we've tried a number of things. We've had for a while a system where people who started work very early before age 16 or 18 or 20 could retire earlier in terms of age. We now figure out that this is actually rather anti-redistributive because people who started work early but had full uninterrupted careers are not the worst off. Therefore, maybe that's too generous compared to what we're trying to do. Then you have we also have another system which is sort of trying to look over your careers whether you actually had physically arduous jobs with a number of criteria. Problem is extending that in order to qualify for early retirement means a lot of red tape for firms which have to say sort of day by day, you know, did you carry heavy loads, were you exposed to chemicals, et cetera, et cetera. So there's, but that's getting more to the matter. And in the end, when people are really against increasing the retirement age, the examples you hear are always people who had physically hard jobs and cannot realistically go on until 64. So of course, the first best option would be trying to train them to do something else when they're 45, but when they're 60, it's too late. And then you have to think of what is a system to target the exceptions to people who really need them and not just, and have some flexibility there. Just on health, I think, I mean, a lot has been said. I think the issue there is to address the surge in demand, to address the demand for also more diversified pathways, also for long-term care. Some people will want home care, some people will not. Sometimes it will be too much of a burden for the family, sometimes not, and to be flexible there too. But also adapt to the fact that a growing share of health spending is long-term chronic diseases with aging, and that puts quite a big pressure on costs. Prevention is essential. Prevention is hard to push to the top of priorities, just as I say, because if it works, then you don't see it, but the costs are immediate and the benefits are sort of diffuse, long-term, and invisible. So that's always hard, but we still have to think about how to design the medical system to incentivize it more, for instance, not compensation by intervention, but sort of based on the age of the general health status of the patient.
Thank you much, Dorothy. Thank you very much, Dorothée. And my last question to Shruti. Again, on your experience and your current work, please give us some recommendations for potential policy reforms that they will be required to obtain an efficient lifelong learning framework.
Well, these are by no means my recommendations, but the OECD has done a lot of work on promoting lifelong learning, several years and several reports, which for those who are interested, I encourage you to dig into. But I think when it comes to older workers, we often think about training as something expensive, something that has to be very long, and often really doesn't meet the expectation or the needs of mature workers. It doesn't have to be. Actually, a lot of older workers and a lot of evidence suggests that are already very experienced. And so it's not so much about, getting them to participate and upskill and reskill. Yes, for some of them that would be important, but for others, it's things about certifying their skills that they've learned over the job over the last 20, 30 years. And that can be a cost-effective way of acknowledging the skills and the transferable skills that people can take from one job to another. An interesting example on that is that a few years ago, Japan had something called the skills passport. And the passport was really about documenting the skills you've acquired on the job. Wasn't hugely successful because employers don't like things that are too burdensome for them. And so I think in response of that and keeping in mind that some of these administrative processes can be costly for employees, a lot of the governments are now responding and having national level-based skill certification systems, which I think are really the way forward for especially this age group. The second thing is, which is under-researched and unfortunately not lots of good evaluation, are things around reverse mentoring and mentorship programs. Again, I think in an aging society, given where older people have lots of experience to share with their younger individuals, these schemes, they make sense. And employers are doing it, but unfortunately in a rather unstructured way. And so could we be thinking about policies and I think be innovative around doing things in a more formal way? I mean, I don't want to be too dogmatic on that. I think there's some beauty about the private sector taking ownership and creating, we don't want to be too prescriptive in telling what the private sector to do, but I think there is definitely more need of evaluation of these programs, but also perhaps some nudge and some support system to actually encourage a more systematic approach encouraging this. Again, in the UK, and I think last year, the government had announced a returnship program. Many older workers had left, so following COVID, inactivity rates had gone enormously large number of older people left the labor market, and actually something called the returnship program was created to get these experience back into the labor market, experienced workers, and actually help them to work in their own way, but actually get that tacit knowledge back into the company level as well. So, and I think there are things like, goes without saying, it's things like even the names of these programs. I mean, do we want to call apprenticeships for older workers, for instance? It's something that's designed for young people and perhaps puts off a lot of older people in participating in these programs. And so I think it's also about communication. It's about making sure the design is adaptable to the needs of older workers. It's not classroom-based, it's modular. I think this is where micro-credentials are taking off big time in lots of countries, making sure that actually not only older workers, but many of the groups that have difficulty in reconciling working and training at the same time, which is quite a big task. How can we make it actually flexible and easy for everyone? So just a few thoughts on that.
Okay, thank you very much. Before we close, I don't know if there are any questions, but okay, we'll take some questions. And with Vivian?
Yeah. Thank you for the presentation. It was very interesting. Just one question. I mean, I do agree that the share of pension is the most important in terms of age-related expenditure. At the same time, long-term care is the most fast-rising component of age-related expenditure. So I think that in this case, emphasis should be given really from moving from institutional to home care, because which could provide a combined care at home in terms of nursing and social care. Many studies, OECD studies as well, have shown that this will reduce the cost of long-term care, and in addition, it would meet really the preferences of older people that they would prefer to stay at home when they get older. At the employment, regarding the employment of older workers, I do agree that the three components that it's more what needs to be done is to improve incentives, to improve employability, and also to improve the demand side, which I do find that it's the three components that can really improve lengthen the working lives. At the same time, we are focusing mainly on what firms can do and how can they adjust. However, some very important elements and inflexibilities, for example, the compulsory retirement age, you see that many countries is also at the public sector. So I think that it should be really an approach that not only some inflexibilities, as I said, as the mandatory retirement age, should also start being removed also from the public sector and, of course, private sector in order to be able to boost the participation. Thank you.
Okay, let's take all the questions because Professor Tsakloglu and, oh, okay, yeah, please go ahead.
Hello? Okay, it works. I have one comment and one idea to provide. Most of the discussions and points were associated with the things that we know best, and these are the older people. The challenge, and going back to Andrew's book, is how do we prepare the younger generations for what they will have to face? I do not know if we have statistics. I do not know if we know how to treat that. And this is, I think, the big challenge that we're facing in relation to longevity. Now, we have to work with things that we have in our hands, otherwise creating new structures, new policies, and things like that perhaps may lead to nothing. Just imagine the Boy Scout movement, or the Scouting movement, because it's not just boys, they're Girl Scouts. Okay? How were they created? What are they doing now? What do they offer? They're basically for youth. Imagine a scouting system that brings youth and older people together to meet every so often, to change views, to change ideas, to work in the intergenerational aspects on all the multiple facets of what longevity brings: technology, respect, human rights, civic education, all those other things. Now, we have to try to imagine things like that and then encourage them to put them together and go down to the roots, the local governments, the communities. This is what happens in Australia, for example. The people are working together, and they have much better relationships within a community than we do in Greece here. This is what I wanted to say.
Okay, thank you. I have a small question regarding a minor point of Lisa Berkman's presentation. However, it's a major point for me, so I'm raising it. I feel very uncomfortable whenever I hear that women do not have children because they work. Because, first, I don't think it's true. Because, at least in Europe, we have the Mediterranean paradox where economies with very low labor force participation of women have very low fertility. And within these countries, those who have children are those who work. So I understand that there is an argument regarding greedy work and standards of all-day working that are completely inhumane, let alone child hostile. But this cannot be packaged as work that makes women not want to have children, because it can become toxic, especially in traditional patriarchal societies.
Okay. First of all, two comments on David Koenig's presentation. Let me disagree completely with your statement that economists are using as a welfare indicator GDP per capita out of intellectual laziness. In fact, there is a huge, enormous literature on finding alternative welfare indicators there. All this literature comes to two problems. One is the problem of selection. Most of them are arguing on multi-indicator indices and so on. The first is selection. What do we put there? Do we put longevity? Do we put education? Do we put freedom? Or all these kind of things. Second, it is a question of weighting. Do all these factors have the same thing? However, the resilience of GDP per capita and especially monotonic transformations of GDP per capita, like log GDP per capita, because the differences are far smaller there, lies somewhere else mainly. All these other indicators are, almost all of them, strongly statistically correlated with GDP per capita. Therefore, it is not that it is such a good indicator as such that it is a proxy for all these other things. The second observation, you mentioned there, and I think that this is, I'm very sympathetic to this view. Let's move away from the statutory retirement age and make, let's say, more flexible arrangements. Yes. All these demonstrations in France, and even more so in this country, were not about more flexible arrangements, were for the retainment of the same benefits, despite the fact that we have an increase in longevity, and if it is possible to have an earlier retirement with the same benefits. This is what they were arguing for. Therefore, this is a completely different kind of an argument than the one that was presented. In fact, you made a very good argument in the panel discussion now. However, I'm very pessimistic that this will never take root in the public discourse or in public action. Are we prepared to say that women must have lower pensions than men for equal contributions because on average they are living 4 years more than men? Are we prepared to say that better educated workers must have lower pensions because they are living longer? In fact, in these papers that you mentioned there, I was expected to see, there is a very eloquently entitled paper by Land Pritchett and Larry Summers saying, welfare is healthier. This is precisely the thing. Are we prepared to go in this way? I do not think that in any public discourse I have heard arguments like that. And finally, a short comment on Shruti Singh's paper. Shruti, lifelong learning is a form of training. It is an investment in human capital. And like all investment, time horizon plays an important role. Therefore, irrespective of the policies that I'm very sympathetic to your argument as well, we will always observe this distance in the type of training, amount of training that older workers are receiving vis-à-vis younger workers. Because younger workers have a far longer time horizon to exploit this investment than older workers.